On a tour of the Ashanti region by President Akufo-Addo last year, Health Minister Akufo-Addo assured contractors would move to site few weeks from the day of the visit.
End of the month, they will mobilize to site and start working seriously in that place.
This was in October 2019. Government says it found only $38.3 million of $175 million allocated for 6 district hospitals and a residential facility in various parts of the country. Kumewu and Fomena are part of the facilities financed by the United Kingdom Export Financing, and work was expected to be completed in 5 years. Dodowa District Hospital is the only one of the 7 to have been completed, while work on Sekendi, Abetifi and Garu projects like Fomena and Kumewu stalled. A housing project for health personnel in Takoradi also suffered similar fate, as change of government saw investigations into the projects. In July last year, ahead of the president's visit, the health minister gave the first assurance of resumption of work.
I've got to go ahead from government that the contractor should continue with 3 that we're getting close to completion. The Fomena one is about 80% complete. The Kumewu one is about 60% complete. And therefore in Ashanti region, these 2 could start or they could recommence work whilst we talk about what we will do. And I've told the chiefs and people of the areas where these facilities are located that within the next 2 to 3 weeks, latest 1 month's time, we might see some work recommencing. The contractor will mobilize to site.
Nothing has happened since then at the 120-bed facility site at Kumewu. Weeds continue to swallow the structures whose stage of work is put at 60%. On 2 occasions, dry weeds caused by harmattan winds caught fire and exposed the buildings to risk. Few years ago, this place used to be a storeroom for the contractors. Here, they kept pipes, polytanks, and other equipment they were using to construct the hospital. Not long ago, an inferno swept through the place, razing everything to the ground. Some of the equipment have been carried away from the area, but still there are few ashes of the polytank and pipes here. But for the timely intervention of the security men here, the buildings would have been razed to the ground. Structures meant for staff residential accommodation attached to the hospital are almost done. Some of them have already been roofed, and one of them is defected due to neglect. Here is Omanhene of Kumewu, Barima Akufo-Addo, who sums up sentiments of his people over unfulfilled promises of fixing the hospital.
I'm a medical doctor, so when it comes to areas like this, I have some knowledge. When the health minister visited me, he promised the contractors would be on site in 2 weeks, but to no avail. The president also visited, and we haven't heard anything since.
This year, begin constructing 88 hospitals in the districts without hospitals. It will mean 10 in Ashanti, 9 in Volta, 9 in Central, 8 in Eastern, 7 in Greater Accra, 7 in Upper East, 5 in Northern, 5 in Oti, 5 in Upper West, 5 in Bono, 4 in Western North, 4 in Western, 3 in Ahafo, 3 in Savannah, 2 in Bono East, and 2 in Northeast regions. Each of them will be a quality, standard design 100-bed hospital with accommodation for doctors, nurses, and other health workers. And the intention is to complete them within a year. We've also put in place plans for the construction of 6 new regional hospitals in the 6 new regions, and the rehabilitation of Efiankwanta Hospital in Sekondi, which is the regional hospital of the Western region. We're going to beef up our existing laboratories and establish new ones across every region for testing. We will establish 3 infectious disease control centers for each of the zones of our country, that is the coastal, middle belt, and northern, with the overall objective of setting up a Ghana Center for Disease Control. The recent tragic CSM outbreak, with over 40 deaths, has reaffirmed the need for ready access to such infectious disease control centers.
Right. So, start with you, Dr. Yankson. We had the Deputy General Secretary of the Ghana Medical Association speak to Star FM and say that while this may be a laudable, thing, there should also be focus on producing the personnel that will man these hospitals. But start with, what do you make of suggestions that the focus should rather be on finishing those structures, facilities that were commenced and have not been finished, that have been abandoned? The minister says they have not been abandoned. And of course, a couple of them, we know about RAGE that was finished, has become very useful. University of Ghana has become very useful. So what do you say about that? Should we be thinking about building new ones or finishing the existing ones?
Okay. Samson, thank you. I think that we need to understand certain things. We need to first draw a line, separate the 2 issues. As far as we are concerned, the 2 issues are 2 separate agendas altogether. The first is that you have a set of facilities that have been started. Some resources may be available because we contract loans and what have you for some of these projects. Others, there may be some technical, logistical, financial difficulties in there that we need to resolve. As the GMA has always said, these health facilities, whatever it takes for authority to ensure that they are completed for the common good of the Ghanaian, it should be done. So that bit, we don't think we should haggle over it. Secondly, from the records, as you also mentioned, it is clear that most of these hospitals are being attended to. Ghana East, which is now one of the major treatment centers for COVID-19,
right,
was a project that had not been completed at the time the previous government exited. But now it's been completed and it's in use. So clearly, some activity is happening. Maybe the question is the speed. And at this point, we want governments to ensure that these things are sorted out. And this was a call we made, some time back, probably a year ago or something, when UGMC was in the news. We made that call that for us, we should ensure that whatever we set out to do.
The question is, if the purpose, as the president said, is to ensure ready facilities to help in the pandemic's fight, is it not reasonable to expect that those that are almost completed, some of them just a few fittings that is required, should be the focus, rather than looking for money that is not there to begin, 94 new ones?
See, Samson, I think that if we mix up the issues that way, then we are being, in quotes, a group of people who want to disadvantage our own. 88 districts without district hospitals. You cannot say that that is something that we should not be worried about. So whilst we try to fix the ongoing ones, we should also begin to think about them. I mean, with this same analogy you made, imagine these 88 districts, there are outbreaks of any kind of infectious disease, including COVID, there at the moment, God forbid, and they don't have places to manage them, how are we going to move on? 88 is a huge number compared to even the number of facilities that are yet to be completed. So we cannot neglect that whole bit, especially where as a country, we've always had a policy that at least every district should have a district hospital. So let's go to the second block, the 88 plus the 3 and everything summing up to about 94. Look, the issue of infectious disease centers is one that as a country we've played lip service with for so long a time. And if at this point COVID has exposed a lot of inefficiencies and inadequacies in our system, and the state through the president has taken a decision that we want to construct these infectious disease centers, for us as the Ghana Medical Association, we endorse it because we've always called for it. During the Ebola pandemic, we called for it, and even this year, within the current COVID bid.
As far back as 2004, 2005, I did a research by way of a documentary for the BBC when I was reporting for the BBC, and discovered that the number of Ghanaian doctors in New York were more than all the doctors in Ghana put together.
Yes, at some point,
the situation has not changed. The situation has not changed.
No, the situation has changed now. Now, the situation has changed. At some point,
the question
New
really,
York alone had, when I was in school, for example, New York alone had about 700 Ghanaian doctors, and we couldn't boast of that as a country. So that bit is clear. But now, our numbers have gone up. But that is not to say that the brain drain hasn't affected that. But all we are saying is that important institutions like infectious disease centers, we need to ensure that we have them as part of our healthcare delivery system. So we will always vote for it.
Okay.
Now, the district hospitals, or let's say the regional, the policy is that every region should have a regional hospital. It serves as secondary to tertiary level kind of care for that particular region. We have created new regions, and clearly we need to ensure that they also get health facilities. Then comes the districts. As for the 88, like I said earlier, it will be out of place to say that we shouldn't construct hospitals. Maybe the timing is what people are talking about. But if we also look at it properly, this timing could also be the best for us, because I know that out there, I don't know how we are going to finance this 88. I must be honest. I'm not part of the state. But I also know that out there, this is one of the best times to get cheap sources of grants, loans, or whatever it is for health infrastructure and the fight generally towards.
What do you mean by that?
No, you see, we have a system where around this time, the whole world is focusing on health. So if as a country, for example, we need to go out there and get some facility to support our fight against COVID, it will be easier to get that facility than in times that you don't have these things. The cost of getting that facility might be cheaper than at the point where you don't need these things. Of course, when you get your funds, as a country, you will decide how you are going to apportion the distribution of those funds. But like I said, I'm not part of privy to the details. But all I'm saying is that this might even be the best time for us, because we could get easy sources of money which are relatively less cheaper for us as a people. And then we take the bold decision and build. But once government has made that call, I think that the onus lies on all of us, the media, the health service, and every well-meaning Ghanaian, to ensure that government fulfills that promise for us. It should not be a lip service.
All right. As someone who superintends over this sector in a more direct way, what should be the focus? Building, 94 new ones, or finishing what is there? And there's quite a number of the facilities that were done by the Mahama administration. I'm trying to get the exact figure because I have worked with those numbers before. So what should we be looking at?
Well, thank you very much. I think we are creating the impression that the new ones are going to be replacing those old ones. You can see there's a lot of effort making sure that those ones are completed. People have moved to sites, some contractors have been changed, etc., to be ensured that these things are completed. But as part of our policy and our part of even our COVID response is to ensure that we have to strengthen the health system. And strengthening health system also mean that access to care must be good for all. I mean, even in the interest of equity, that all districts must have their own first level referral facility where they get. I'll give you an example. If you go to, say, in some, there are about 4 districts around there who do not have hospitals. And so anytime you go to the hospital, it's fully congested. That affects quality of care, etc. And so it is important that these things are done, and so that our referral levels are properly done with, and the proper care is given, instead of having regional hospital choked because there are so many people without a first referral level. And that's what comes to the 88. And that is an extremely important, especially now we are not talking about...
And these are the same hospitals you talk about where you have one medical officer who is inundated with so much. Some of them practically can't really do anything. I mean, apart from just living literally at the hospital.
I think that's another level that we need to look at. GMA also knows that probably there are more doctors we are not even employing, who are now, we have a net receiver of doctors. Every year, apart from those trained here, we have those trained in China, Russia, and other places coming in. And so I don't think that we will have such a big challenge talking them. We need to ensure, and I always said that regions also have the responsibility to make their facility more attractive for people to work there and feel comfortable working there. So those are all things that we need to look at and ensure that not just they build them, but they are also staffed. And that is why these are coming with decent accommodation. That's also an incentive for people to move there.
We know what happens in this country. These projects normally will start and they take forever to do. And the prices will continue to go up. Somebody, if there's change of power, somebody may abandon or delay in taking care of the project. They will start a new one, leave the one that's already there, as we have seen with affordable housing projects. Affordable housing projects that were started by President Akufo are still being, worked on. Some that President Mahama also started, almost done, are still sitting there. And we have heard of new plans to start new ones too.
Yeah, but sometimes I think these are the areas that we also must take cognizance of the fact that what are the factors that lead to that delay? Are there contractual challenges that creates these challenges? What are the things? How do we ensure that those things are done? Because what I know is that even in districts where the construction is ongoing, it's not part of the number that has been listed.
Okay.
Which means that there are plans to also complete them. So it's not a question of a replacement. I think what we need to look at, how do we ensure that when a facility is supposed to be built in 30 months, that we all work towards that. I think those are the challenges that we need to address. What are the bottlenecks and how do we address them as we run contracts, as we start? So those are the things, for me, we need to look at. But it is extremely important that we build our systems so that people don't have to travel too far for care. People get the best of care. The infectious disease, this is not going to be the last outbreak you're going to get. And so as part of our response was also building our system to be better placed when the next pandemic comes up. And so bringing infectious disease centers that may have research facilities around it is extremely important that as a country, as we move forward, we are better prepared for the next one, so that we don't have some of the...
Okay, some of these things are even long overdue. Okay. And we need to be honest about it. Look, in Nigeria, when they had their first case, they quickly moved the patient to the infectious disease center. We are here and we are now struggling to even look for places to keep some of these, patients. We've had meningitis happening in the northern parts of the country now. If we had an infectious disease center there, we can quickly mop up within the system and get all patients properly treated in a facility that is built and designed for that purpose that we want to get to. That way, it also improves our health systems, it improves the quality of care. The health professionals who also work in there are also motivated to work and work properly. Sometimes the improvisation and the difficulties around what we do end up even demoralizing some of the health professionals. So we need to take the politics out of this and ensure that, look, governments, whether green, pink, whatever color, as and when they come in, they do the right things that will benefit the people at large. And there's nothing better beyond health and education.
Okay, so Kwame Sapong-Esedu, what will be your approach? Clearly, some say this is the political season. The president is using the COVID period to taking advantage of the COVID period to do politics. But what is wrong with, you know, doing new hospitals when there are some others that need to be finished?
You see, Samson, thank you. There's something that we should all learn from COVID. If there's anything that this infection has taught us, it's taught us that worldwide, we haven't invested in our human security appropriately. We haven't invested in healthcare, and Ghana is no exception. I mean, if you look at the Global Health Security report that came out in October last year, it stated clearly that the world wasn't prepared for infectious diseases. I remember writing a lot about it, and at that time, it quoted Ghana's Global Health Security Index as less than 40%. It's about 32%. So what Dr. Yankson is saying and what Dr. Abuaji is saying are all correct. We need all these health facilities. And I am glad that everyone agrees that the ones that are historically there should be completed. And I also agree with Dr. Yankson that you cannot have districts without district hospitals. So if we've created those districts, we need to be prepared to resource them with the infrastructure. Sure. On that basis, I would say that I wouldn't have a lot wrong with what the president said and the fact that he wants, in fact, I've said it publicly on social media and other things that I don't see anything wrong with it. But what I would see wrong with it would be if it turns around that these are prioritized to the detriment of the others. And that is what, like Dr. Yankson said, and I agree, we need to keep our eyes on the ball and make sure that all of them are done.
Yes, let's have Dr. Silverkin. I suppose that the good news in what the president said while he spoke about the hospitals for you was the infectious disease centers and to eventually think about a national, you know, sort of center.
Absolutely. I have been excited since I heard the president say that, because, I mean, for this current pandemic, even if you want to conduct some research, it becomes very, very, very difficult. For example, we don't have a biosafety level 4, so we are already limited if we want to culture the virus. So we can just do with a biosafety level 3, which we need to inactivate the virus. So for me, I think it is a plus. And it is not just a matter of putting these buildings up, but then resourcing these facilities, so getting state-of-the-art equipment. Because for me, I keep on saying that Ghanaians are brilliant. We are very excellent. We are only shortchanged or challenged when it comes to the needed resources, i.e. the technologies, the equipment and the likes. But if we also get such equipment and the resources, we'll be able to do a lot. I mean, we can be doing all the vaccine trials and looking at not vaccine trials, but then coming up with some leads in terms of vaccines, medications, and the like. So I side with your panelists in the studio, as well as Kwame Asiedu, that it is so very important that we use this particular pandemic. I mean, I haven't seen a pandemic before. So I think we need to use this as a very good opportunity to at least build on our existing systems. And I expect the media, as usual, to be following on these things keenly to ensure that they are actually brought into fruition.
All right. Now, Kwame, you... Okay, I think we've lost Kwame there, but that should be okay. We are actually running out of time. What did you want to say?
Yes, some of these
Kwame is back, yeah.
Old hospitals that are going on, some of them have secured grants or severe loans that is running. So they should really not be mixed up with these new ones that are going to happen, so that whatever, whether there are contractual challenges, whether there are contractors who are not doing what they are supposed to, those are the things we need to do and make sure. But I know that for my estate and the capital investment, these are projects that are currently ongoing, and there are plans to make sure they are all completed, separate from this 88, which is also very critical that all districts must have hospitals, so that we can really be able to be up and doing and be able to better prepared for whatever, not just the next update, but also ensure that the people become healthier and access to health becomes easy for all.
Okay. But Kwame, as you listen to the president, did you get the impression that these are first and foremost for the fight against COVID-19? And what does that suggest? How long are we looking at for the disease to sort of get out of the system?
Well, Samson, I mean, the disease is not going. This bug is going to stick around for a while, and we all know that. I mean, if you look at all the projections that are being made internationally, the best option would be for a vaccine to be developed. Even with the vaccine, there are issues around how long it will confer immunity for, and how long the immunity is going to last, whether it's going to be once in a lifetime vaccine like some vaccines are, it's going to be like the flu jab. So to answer that question as to did I think that it was for this COVID fight, probably yes. But do I believe, I mean, just to be quick, I've made a number of observations that to build 88 hospitals in a year is a huge challenge. And the other thing we have to look at is that year actually has an election in the middle. So suffice to say, if we are a country that leads, we would realize that there's a possibility that the election could go either way. Nobody knows until about the morning of December 9th where this election is going to go.
That's if the elections do come on at all.
Yes, but if it goes any other way apart from the president getting a second term, then we are in uncharted territory as to this issue of legacy health projects and how they get abandoned. You talked about the, affordable housing schemes of former President Akufo and now from the Mahama era. So we need to get to a place where we are learning and realizing that health must not be politicized. So if a president makes this commitment, we should see it as the president of Ghana making the commitment on behalf of the country and not Nana-Addo making the commitment. Because if we don't devolve the presidential commitment from the individual who occupies that seat at any particular time, we would always have these problems because when someone else comes, they want to leave their legacy.
All right. Thank you very much. Gentlemen and lady, I would like you who are with us on Zoom to give us just some 30 seconds of your very final words by way of advice to everyone who is listening and how they should protect themselves. Yes, starting with Dr. Silverkin.
Yes, so just for all of us to realize that, look, the virus is here. And like Kwame said, it will be around with us for quite a while. So it behoves on every single one of us to adhere to the various recommendations, i.e. wearing of nose mask. Let us learn how to wear the nose mask. Let us learn how to remove the nose mask.
Right.
Obviously, not forgetting the social distancing. Let us learn what 6 feet is or 2 meters, what 2 meters look like. And importantly, let us also not forget about that hand washing bit.
Right. Thank you so very much, Dr. Silverkin. Dr. Augustina Angelina Silverkin is a lecturer, Department of Theoretical and Applied Biology, KNUST, and research scientist and virologist at the KCCR. Yes, Kwame Sapong-Asiedu, what will you say in 30 seconds to Ghanaians all over the world who are watching you now? What should they do?
Well, what I would say to Ghanaians, and especially to those who are interested in following, is the fact that this virus is taking us on a tutorial. 7 weeks ago, the WHO advice was that face masks do not impact in any way. Today, it has changed, and you are all wearing face masks. When this disease came, it was said to be a respiratory disease. Today, we know that it causes multiple organ shots and all that, and the treatment protocols have changed drastically. It is not classified strictly as a respiratory disease. What it means is that if you live in a fool's paradise that the virus is not here, and that you don't do the basics, which requires you from not contracting the virus in the first place, you are turning yourself into an experimental animal on which these new avenues of health will be found, whether it's because now we know it even affects the clotting of blood. There's so many things. So you are going to be the guinea pig from which we would learn.
Thank you.
I don't want any Ghanaian to be a guinea pig. So please wash your hands and wear your mask.
Thank you so very much, Kwame Sapong Siedu. And before I take my very final words from the gentleman in the studio, let me remember to say happy birthday to Santok Singh, former manager of this very channel of Multi TV, and also happy birthday to King Ramsey Kweku Bako. This is from your mom, Aisha Bako, and all your siblings, Princess Fathia Ama Bako and Roy Kason Kofi Bako. Right. So, Doc, in some 30 seconds, what will be your message? We always do that before we close the show.
Well, I think that we are at a very critical point in this fight against the pandemic, and that for Ghanaians generally, we should begin to change some of our behavioral attitudes towards the preventive measures that my colleagues have also enumerated, and the state has been championing.
Thank you very much.
We should ensure that we stick to the measures. And
thank you very much, Dr. Justice Youngson. Yes, Dr. Patrick Aboagye.
Yeah, thank you. I think I align myself with everything that has been said, just to say that the health sector is ready to ramp up our efforts to make sure we need the people to be with us. We need people to have their change, and we want to use the opportunity to strengthen our systems so that we'll be ready and be able to offer better care.
Thank you very much. Thank you very much. And the show has been brought to you by Consolidated Bank. We stand with you, MTN, everywhere you go. Dura Plus, where Dura Plus goes, water flows. Ashasi University, educating ethical entrepreneurial leaders for Africa. And Prostat 60 for prostate health management and immune support. Bank of Africa, strong as a group and close as a partner. I'm Samson Ladia Yanini, and thank you as always. My outfit is by Latida. Have a good afternoon.